Hello and welcome back. Today we're going to be talking a little bit about non-communicable diseases. Now, non-communicable diseases are actually the diseases that we think about when we think about chronic or common diseases. These are the ones that in the United States make up the bulk of health impacts on our society. They're, of course, different than communicable diseases, which are diseases that pass typically from one person to another. So let's talk a little bit about them. All right. So first off, as I mentioned, it's really the big hitter when it comes to public health impacts in the United States. It accounts for about 80% of mortality in the United States, and we also spend a tremendous amount of money on these common chronic diseases. So we spend about 86% of our health care expenditures on dealing with non-communicable diseases. So they're really common, and it's also quite common that in America that people live for quite amount of time with one chronic disease or another. About half of Americans have at least one chronic non-communicable disease, and actually a very large percentage of the population has more than one as well. So what we know is that in the United States that the rates for these diseases are increasing here in the United States. We're also seeing that generally speaking around the globe. Now, part of that is due to the epidemiological transition, which I've mentioned previously, which is the idea that as economies develop and as public health systems become strengthened over time, you'll see a shift from communicable diseases, which we have some fairly effective strategies for dealing with, to these non-communicable diseases, which tend to show up later in life when people are able to live more of a full life. So we do see an increase in these diseases across the globe. So again, what are the main diseases that we're talking about here? If you look at the 10 top causes of death in the United States, we see that heart disease and cancer come out at the top. They each account for about 25% of the mortality in the United States. So about 50% in total between the two of them. Then we also see that there's a range of other conditions here. Most of them are common chronic non-communicable diseases. So again, there is a transition. Back in 1900, there was about 4 of this top 10 were actually infectious diseases, communicable diseases. So really, right now, the major hitters for the United States are these non-communicable diseases. Now, beyond the major causes of death in the United States, we also really want to think about what the major risk factors are for death. And the U.S. Burden of Disease Collaborative has put together this listing here. And what you'll see is that there's a range of different factors that we can actually adopt, which are essentially all of them on this list are related to non-communicable diseases. So the major ones sort of fall into categories around exercising and eating right and not smoking in particular as well. So these different factors sort of combine together to increase risk for non-communicable diseases. And I don't think any of the ones on this list in terms of major risk factors for death actually are for communicable diseases or infectious diseases. They all seem to be primarily related to these non-communicable diseases. I'm going to talk a little bit about cardiovascular disease in detail and cancers in detail, because as I mentioned before, they're the big hitters for public health. So it's worth getting a background in them, at least at a basic level. This will be quick, but hopefully it'll be helpful for you. So first off, there's a term called cardiovascular disease, and this is diseases of the heart and the vascular system in the body. Okay. So the main components to this are heart disease and stroke. Okay. Heart disease I'll discuss in more detail, but here I'm going to mention stroke a little bit. There's actually 2 different types of stroke. Stroke is one of the top causes of death in the United States. You see that there's 2 types. There's ischemic stroke and hemorrhagic stroke. Okay. Ischemic stroke is essentially when a blood vessel gets blocked off in the brain, and that causes cell death around that area because you're not getting perfusion to that part of the brain. So you're not getting blood flow to that part of the brain. Hemorrhagic stroke is when you actually have a blood vessel burst inside the brain, and that actually has somewhat different causes than something wrong with the vascular system. So very serious disease, something that is interesting, but especially for ischemic stroke, the risk factors and the considerations are actually very similar to what you see for a heart disease. All right, so what is heart disease? Heart disease is actually made up of a range of different diseases, which have similar factors related to them and actually which contribute to one another. The first type of heart disease I want you to be aware of is just called coronary artery disease. Coronary artery disease is where you see in that image, you see a buildup of plaque on the walls of the arteries where increasingly the blood flow is getting cut off because these plaques are decreasing the size of the arteries. This actually can be a serious risk. So it's part of what causes ischemic strokes, but it also dramatically increases your risk for heart attacks. So another type of heart disease is a heart attack. So a heart attack is when you have a vessel so the heart is a large muscle which has blood vessels that feed the hard-working muscles that pump your heart continuously. And what can happen is if one of those vessels gets blocked off, then the muscles that are fed by it will actually die, and it will prevent that heart from beating, potentially. So this can happen with a vessel being occluded. Typically, this happens because of a clot. So a clot can occur when the plaque that's built up on the sides of the vessels breaks loose and gets lodged and entirely blocks off that blood vessel. So this can kill parts of the muscle to the heart and sometimes can actually stop the heart entirely. Okay. There's a few other types of heart disease that are worth knowing about as well. One is arrhythmia. So arrhythmia is when the heart works by electrical signals that tell it to contract, to pump blood through your body. Arrhythmia is when there's a problem with those electrical impulses to the heart. So this can make it beat too fast or too slow. And there's different types of arrhythmias based upon that. And also it can cause it to be more erratic. So it could just beat irregularly instead of beating the way it should. So what can happen with arrhythmias is that they can actually call what's called sudden cardiac arrest. And this is when the electrical signals function such that the heart just shuts down. So it's not being told to pump properly or it becomes overwhelmed. So this is cardiac arrest is actually different than a heart attack. Heart attack is from the clots blocking blood flow. The cardiac arrest, sudden cardiac arrest, is from an arrhythmia. This can also cause stroke or organ damage as well. Then you have cardiomyopathy. So cardiomyopathy is actually a disease of heart muscles. So this can happen for a wide range of different causes, but essentially what you see is that the muscles can thicken, enlarge, and sometimes it can actually become really rigid, which makes it hard to pump. And this can be caused by arrhythmias and ultimately lead to heart failure. So what is heart failure? Heart failure is another type of heart disease. And this is essentially when the heart is gradually losing its ability to pump properly, sometimes through cardiomyopathy. But essentially what's happening is as the heart becomes perhaps more rigid or becomes too large, enlarges out, it's actually harder to effectively pump the blood through the body, or if it starts having smaller space for blood to go through, or sometimes it actually the heart can enlarge so it becomes too thin and sometimes weak. So there's a range of different ways that this can express itself, but the main point is that it's not pumping blood properly, so that you're not getting enough oxygen to the body. So this is something that will continue to occur. There are things that can be done to treat this condition, but it does typically get worse as time goes on. And ultimately, if the heart can't keep up, then it can cause death. So when we think about cardiovascular disease, I've just talked about the different diseases themselves, but then you have the major predictors which cause those diseases. So there's a range of different factors in cardiovascular disease. One is smoking. So smoking, we often think about smoking and lung cancer, and it dramatically increases lung cancer. But smoking actually, in terms of the number of people it kills, even though it has less of an increase of risk for cardiovascular disease, so many more people get cardiovascular disease that it actually kills more people through cardiovascular disease than it does through lung cancer. So that's a very serious thing. Obesity, higher body weight has been shown to also have a relationship with cardiovascular disease in various different forms. Diabetes is a substantial increase in risk factor for cardiovascular disease. I'll talk a little bit more about that later. And then high cholesterol is another factor that we know a lot about in terms of this increase in risk. So high cholesterol is defined as over 200 milligrams per deciliter. And it's particularly associated with what we call low density lipoproteins, LDL. So that's a number that's the major predictor if you look at the different types of cholesterol. There's another kind called HDL, which actually decreases your risk for heart disease. So you'll see that there's actually a balance there. So there's a few things that increase your risk for high cholesterol, things like consumption of meat, eggs, and milk. There's other things that we know actually decrease your risk. So one is medication. So people who have high cholesterol will very often go on statins. So it's a very common thing. There's even talk about whether we should be using that as a preventive tool, that people should just be taking that regularly. Vegetarianism, because of the diet and taking out some of those risk factors, decreases risk. We know that exercise makes a substantial impact, modest alcohol consumption, and genes as well. So there's a major genetic component to how people's bodies respond to cholesterol and produce cholesterol. So another major risk factor for cardiovascular disease is high blood pressure, also called hypertension. Okay, so hypertension, when you have that, essentially having that high blood pressure actually causes damage to the vessels, to blood vessels. And they actually think that this might actually be because it's actually essentially scraping the inside of the vessels, perhaps with large proteins actually that are just essentially scraping it, and that higher pressure actually just damages the inside of the vessel. And when you have that damage, it makes it easier for plaques to form and to coagulate on the inside of that vessel. And as these plaques build up, again, you have the greater risk of occlusion of the vessel or a clot breaking off and causing a heart attack or something else, or stroke. So hypertension is defined as having 130/80 systolic over diastolic blood pressure. In fact, that was just decreased. It used to be a little bit higher, but they've actually changed the threshold. So that actually a much larger proportion of the U.S. public will now be defined as hypertensive because they lowered that threshold. But they think that people, once they're over that threshold, that they really need to be targeted for treatment. So again, you have increased risk factors like obesity, smoking, lack of exercise, stress can cause this as well. And then there's a range of different factors that decrease risk, like diet and quitting smoking, the opposite of what I mentioned. And there's also a range of different medications, diuretics, beta blockers, ACE inhibitors. You've probably heard of these different medications or know people who have them. And maybe decrease sodium intake, but that's actually pretty controversial right now. So that was heart disease. The other big hitter that we know in terms of health impacts is cancers. So we often talk about it as cancer, but I put in the S there because the truth is that it really is cancers. There's many different types of cancers that affect different organ systems, and they're actually really quite different. And I'll talk about that a little bit more shortly. the main thing that I want you to note is that cancer is a genetic disorder. It's a genetic disease. It's essentially a mutation, a range of different accumulated mutations that allow cells to grow uncontrollably. And that's essentially what it is. So it happens at the genetic level. Again, so as I mentioned, cancer isn't a single disease. It's actually hundreds of different types of diseases, all involving uncontrolled cell growth and that proliferates and causes death. So the thing that makes it kind of challenging to talk about cancers is that each of these forms of cancer have its own distinct causes. They have different appearances. There's different ways that you can act to prevent it, and they all have their own different treatment strategies. So it's a very diverse health problem that requires a lot of different strategies and a lot of different thinking about how to deal with it effectively. So here's just an example of some of the more common cancers that you would want to think about. So in terms of overall mortality, the big hitter here is lung cancer, lung and bronchus cancer. After that, you have female breast cancer, and then prostate cancer and colon cancer. So these are some of the big hitters in terms of health impacts or mortality specifically. But there's also a lot of other ones that you've probably heard of in that list as well. So what does cancer look like? How does it actually occur? Well, at the top here, you'll see that there's the normal normal cell division, okay? It's normal that cells divide. That's part of how we stay alive, right? So in normal cell division, cells will divide and divide and divide. But if there's cell damage of some sort or major mutations, what the cell does is it recognizes that that's a case, or what the body does is it recognizes that that cell is damaged, and it will send out signals, and the body will kill that cell. The cell will kill itself, or will be eaten up by the system, and it will be taken out of operation, right? So that's the body's way of sort of cleaning itself up of these dead or dying or damaged cells of various sorts, essentially by killing them. Then you have cancer division. So cancer division, cell division, what we see is that there is this process where you have an accumulation of mutations. So usually it's a case, a single mutation will not typically cause cancer, actually. You usually need a number of different mutations that allow for this uncontrolled cell growth. So you'll have a cell that has, say, one mutation, and then you might get one of those cells might develop a second mutation, and then a third mutation. And sometimes with that fourth mutation, suddenly you have major morphological changes. You have the ability to go through an uncontrolled cell cycle. So then you'll have this rapid growth of cells. So it builds up into a cancer. Okay. So that's essentially what cancer is. It's an accumulation of mutations that allow for this uncontrolled cell growth. Now, when we look at a normal cell cycle, we have G1 or interphase, which is at the top there. There are a range of different things that the cells do, genes in the cell or proteins in the cell that actually ensure that the cell doesn't grow in an uncontrolled way. So oncogenes are genes that, when they're mutated, can actually cause the cell to grow really fast. It's essentially pushing on the gas to move forward through that cell system and continue to grow. So that's one way that cancer occurs. So many of the mutations that we see are producing oncogenes. Okay. Then there's tumor suppressor genes, and when it's when it's functioning the right way, what it essentially does is it stops the cell from replicating if there seems to be anything wrong with it. Okay, so it actually is it's essentially the brakes, right? But if there's a mutation, it can actually destroy the brakes on the car, and it can continue on through the cell cycle. All right. And then you have DNA repair genes. And DNA repair genes work throughout the entire cell cycle. But essentially what they're in charge of is making sure that mutations are fixed, or if the mutations that just occur normally in a cell can't be fixed, and they can sometimes target the cell for apoptosis, for being killed. Okay. So if you have a mutation in a DNA repair gene, then what that means is that these mutations can build up, and you can just get more and more of them. And as you get more and more of them, as we saw before, it's accumulation of these mutations that ultimately lead to cells starting to go through the cell cycle really fast and in an uncontrolled way. All right. So you've all heard about stages of cancer, okay? So when someone says I have stage 2 or stage 4 cancer, what they're essentially referring to is a way of categorizing cancers based upon where they're at. So cancers often say small. Sometimes cancers can even be benign. They're growing really slowly. They're not really impacting an organ system. So that's what we call benign cancers. But you have stage 1, which is a fairly small cancer, usually very localized. Stage 2, it's starting to grow outside of that area. Here we're looking at colon cancer, but that's true for most of them. Stage 3, you're very often exiting outside of that specific region and into other tissues. You're also seeing a lot of cancer cells going into lymph nodes, which is shown here by the dots inside of the lymph nodes. And then stage 4 is referring to metastasis, which is when the cancer cells have had mutations so that they are actually leaving that region of the body and they're entering the bloodstream and traveling to other organs, for example. So for colon cancer, it might travel into the liver, and you might start having those cancer cells growing inside the liver. So that's a very dangerous situation, because once it's spreading throughout the body, it's actually very hard to stop. So the way that cancer actually kills people is that it's essentially what it can do is it can start impacting the function of that organ, and it can shut down. For example, colon cancer can cut down the body's ability to absorb food and digest food. So this is or it can, just grow and start pushing. If it's in the brain, it can start pushing on the brain. So these cancers do things to eventually degrade the function of an organ. So what causes cancer? Well, there's a few different things that predict or are risk factors for cancer. So some of them are internal to the body. So things like heredity, so genetics. So there's a range of different mutations that people can have that can increase their risk for developing a disease. BRCA1 and 2, for example, risk factor for breast and ovarian cancer. If you have those mutations, it's essentially in a tumor suppressor gene that allows cancer to grow uncontrollably. So there's a range of different ways that these genetic factors can increase risk. Dietary factors a range of the different ones have been shown to increase your risk for diseases. For example, eating charred meat, carcinogens can increase your risk for cancer. And then hormone levels has also been shown to sometimes influence cancer risks as well. There are some chemicals that we are exposed to in the environment. Certain pesticides, for example, some chemicals that you find in labs, like benzene, for example, or in industry and production. There's also a range of different viruses and bacteria that can increase risk for disease. For example, HPV increases risk for cervical cancer, right? So these can cause disruption in DNA and increase your risk for mutations and cancer outcomes. And then there's radiation, where you have direct damage to DNA through either radon or sunlight, for example, can cause this. And these are different predictors, and they're going to vary depending on the type of cancer that we're talking about. So, for example, radiation is really important for skin cancer. Viruses might be really important for cervical cancer. So it depends on the type of cancer that you're talking about. And that's why cancer is sort of complicated, because there's typically isn't a one-size-fit-all answer for how to prevent cancer in all different conditions. So In terms of prevention, there's a few things that we know about that are very often helpful. And again, it's going to depend on the type of cancer. But one is just decreasing exposure. So whatever it is, those risk factors that we're concerned about, you can decrease exposure to that risk factor. The other thing is changing diet. So high fiber, low fat, low carcinogen, those are the types of food that you want to focus in on. Vaccines can make a difference. So the HPV vaccine, for example, is shown to be very, very effective. Hep B, also very helpful. You can also do genetic testing. So genetic testing, especially if you have a family history of risk for developing cancers, where several of your immediate relatives have developed a certain type of cancer, well, that might mean that runs in your family. And sometimes you can actually find out through genetic testing that you're at substantially greater risk, and you can do things to decrease that risk. And then there's also screening. So mammography, for example, checking to make sure that you don't have breast cancer and doing that regularly. That can be something that can be important to do, or colonoscopies for colon cancer. So doing that screening, and I'll discuss at another point how that works, can be very important for disease prevention, because you want to catch it before it sort of metastasize. The earlier you catch cancer in its progression, the better the treatment outcomes. All right, so the range of other non-communicable diseases that you should also be aware of. So diabetes. Diabetes is where you have heightened blood sugar levels. There's type 1, which means that you can't produce insulin, and that's pretty rare. It's about 5% of diabetes cases. Much more common is called type 2 diabetes, and that's where you're becoming sensitive to insulin. It's actually really dangerous, and it increases your risk for cardiovascular disease. It has a wide range of different health impacts itself, and it is one of those top 10 causes of death in the United States. It's also very common. So you have about a 35% chance of developing diabetes in your lifespan before you die. Most of it happens later on in life, but it is something that people have a really high risk for in the United States. And it's also a disease that's really increasing in terms of risk. There's also chronic lower respiratory disease. So we have particularly chronic obstructive pulmonary disease. So, for example, emphysema. Emphysema has multiple causes, mainly from breathing in particulates, typically from tobacco smoke most often. But essentially, it's where you have collapse of the alveoli in the lungs and the flooding, and so that you can't actually effectively breathe anymore and absorb oxygen into the body. So that's extremely dangerous. Asthma, where you have constriction of the pathways, bronchitis, again, very serious condition where you stop being able to breathe properly, and associated with infection as well. And then you have nephropathy or kidney disease, also extremely serious and very common. So that's where your body stops being able to remove waste from your body. A range of different causes, alcohol, infection, a range of different things there that cause it, but also a big hitter in terms of mortality. Then we have Alzheimer's disease. Alzheimer's disease, we don't know all the causes. Some of them are known to be genetic, but essentially it's a neurodegenerative disorder where there's a buildup of plaques in the brain, and you have increasing cognitive challenges. Eventually, that progresses to death as people start losing the ability to eat and swallow properly, typically, and other causes as well. And then you have mental illness, very common. It's one of the major causes of disability. So here we're talking about depression, anxiety. It can be addictive behaviors. It can be schizophrenia. Together, these diseases have a huge impact on quality of life, and it's extraordinarily common. A very large portion of the population is going to experience it, at least at some point in life, and for many people, they'll struggle with it continuously. So very common, and everybody here knows people who are challenged by that. So another really important condition. And when you think about this from the dailies, qualies sort of perspective, you find that's actually really has a huge impact on health and people's well-being in the United States. And then you have arthritis. Arthritis is actually really very common. About 20% of the population has some form of arthritis. And when you actually look at it, it has it's one of the leading, it is the leading cause of physical disability right now. So a very serious disease that we don't talk about a whole lot, actually. But something you should be aware of. Also causes a great deal of pain. So a lot of suffering associated with it as well. All right. So that's just a really fast overview of a lot of the major non-communicable diseases, a little bit about what they look like and what they do. These are things that you can learn a whole lot more about, and I hope that you do. But there is a certain amount of overall arching messages here. We saw a little bit about what the direct causes of mortality are, but we also saw that there are certain factors which are major risk factors. So when we think about public health, we want to help people to avoid different diseases. And what we find is that there's really, if you do three things in public health, you will make potentially make a huge impact on your risk of developing a chronic disease. And those three things are eat a healthy diet, exercise, and don't smoke. And a lot of public health really focuses in on those three things for good reason, because they're actually incredibly effective across these different non-communicable diseases at decreasing risk. So that's about all I have for you today. Again, the ideas here are that there are some major non-communicable diseases make up the bulk of health impacts in the United States. There's a few major ones, heart disease and cancers, which are extremely serious and make up about half of our mortality in the United States. Then we have a range of other ones as well that need to be considered. And then there's also a range of different things that we can do to actually prevent these diseases from progressing. And we can all think about how we can develop interventions to help people improve their health. So thank you very much and take care.